Good evening and welcome to Interviewing Techniques. This evening we'll be talking about interviewing techniques, particularly as you get ready to use your survey instrument, your questionnaire that you have developed. So, by definition, interviews are useful for getting the story behind a participant experience, or it can be used to pursue in depth information around a topic. Interviews are also useful as a follow up to certain respondents. So you've asked a set of questions before, you have intervened, and you follow up with a set of questions to kind of assess how the intervention worked for the participants or respondents. And these definitions were put forward by McNamara in 1999. There are different types of research data collection techniques, and dependent on the data you are collecting or the type of research you are participating in, then you may or may not use some of the techniques that we will go through today. So, at the outset, we think about all research data, and some data might be secondary, and so there is no need for collection. You are primarily working with data that has been collected by individuals before, and you are going to just go right ahead into your analysis. On the right side, you have primary data. And this is data that you are either going to collect quantitatively or qualitatively. So we think about quantitative data when we think about our survey data or observational data or data we collect for experimental purposes. For your survey data, you can either do a personal interview, a telephone interview, and now we have techniques that we can administer these via computer using things like Google Forms or Google Docs or SurveyMonkey, just to name a few. On the other side, we have our qualitative data that we are collecting, and usually this takes in the form of focus groups, in-depth interviews, or kind of projective techniques. And we won't speak much about these techniques on the right side when we're talking about qualitative data, because for our purposes, we're addressing collecting survey data. So questionnaires have been around for a while. They were invented by Francis Galton in the 19th century, and they can be self administered or interview administered. And they can also be a part of a survey, as well as we can do other measurements within a survey. The questions that make up your questionnaire can either be open ended or close ended. And we know that close ended questions are those that comes with a set of selected options for your participants to choose from. For questionnaires to be implemented appropriately, the objectives need to be defined clearly in terms of the study you are conducting. The instrument needs to be constructed appropriately according to specific constructs or content. And it is important to pilot or to pre-test your questionnaire just to kind of work out any challenges that respondents might have before you actually go into using this to collect data for your research. Administering the questionnaire requires some amount of practice and technique, and so persons who are administering questionnaires are usually going to have to get some amount of training. Finally, after you have collected your data using your questionnaire, you want to analyze and report the findings of your study. So, when do we use questionnaires? We use questionnaires as a monitoring tool. They can be effective if done on a small scale and a targeted basis. So, we wouldn't do a survey that looks at an entire country, but rather a sample of that country, meaning a subset of the country's population. The questionnaires can be used as an evaluation tool. They can offer a broad perspective and can allow comparisons across different communities. So here we are assessing uh, your research question, and we want to find out if let's say, for example, the number of persons who are food insecure in one community is the same as the other. So we would implement a food insecurity questionnaire in community A, and we would do the same in community B. That allows us to compare what levels of food insecurity are in community A versus community B. So questionnaires can be really useful when conducting public health research. They are inexpensive to use, unlike if we were using medical devices to capture images. Questionnaires are inexpensive. They can be used to obtain data from large number of participants, and because the questions are objectively written down on paper, they limit interviewer bias as you'd find in other methods. They are less intrusive than interviews. They are potentially better samples because people feel more comfortable going through questionnaires as opposed to having someone there interrogating them, or at least it feels like interrogation at times. And then there is standardization. Because the questionnaire is a standard instrument, each participant who participates in your survey will be experiencing the same set of questions in the same manner each time. They can reach a wide range of people in terms of age group, ethnicity, sociocultural background, and so questionnaires in that regard are very advantageous. Confidentiality is a very important thing to participants in research, and so with a questionnaire, they are the only ones seeing their responses, and they know that they're not necessarily communicating within a group or where there are more than one persons there, so that their information might be shared. However, as with all things, questionnaires do have disadvantages in that if they are standardized, so that it is not possible to explain any points that might be misunderstood, then you can have lack of clarity. Open-ended questions sometimes requires some guidance because it can generate a lot of data. Like people can go on and on with open-ended questions in terms of what they write, and so it takes a longer time to analyze that. If the respondents are not at the literacy level at which the questionnaire was developed or the questions on the instrument was developed, you can have a problem with understanding, and that can increase the amount of missing data you may get when you encounter people of lower literacy level. Sometimes, if questionnaires are too long, participants will give superficial answers. They'll not go in depth, they'll just try to rush on. So, you want to ensure that the questionnaires are not too long and prevent what we call participants' fatigue. Sometimes there are design problems. The instrument is designed to measure a particular construct, but that construct was not conceptualized correctly. So we're asking people about headache and not migraine. There are two different concepts that you want to capture, and so that might present a problem. There are also possible time delays, especially if you post them or you leave them with the participant and you are expecting the participants to give them back to you or to mail them back to you. Then that can be delay. You can also have significant amount of non-response, meaning you just fail to get those questionnaires back in totality. So you have many types of questionnaire, and we have looked at this in a little before. You have self-administered questionnaire. Those are usually typically over the web, by telephone or mail or by email. And then you have the interview administered questionnaire. This is where your person sits down with you and they ask you the questions, or they read the questions to you and you provide a response. This can be done singularly, meaning individual to individual by telephone, or it can be done in a group. So, for example, if you're administering questionnaires to a class, asking them about their belief in terms of, let's say, sexual health and condom use, you may administer this en bloc to the entire class, but each person will have their questionnaires going through on their own. When you do use a questionnaire, it's important to ensure privacy, to corroborate the evidence from other findings. So if you are asking people questions that you think they might likely give you a response that you're looking for, often called the white coat effect, what you want to do is to build in multiple questions that are addressing the same thing to see if you can kind of corroborate. In qualitative research, they talk about triangulation, getting the same information from multiple sources just to kind of prove the veracity of the data you're collecting. When resources are limited, you will benefit from using a questionnaire as opposed to any other method that can be very time consuming and also require a lot more resource. So why do we use questionnaire? One, we want to standardize the interview process. We want to ensure that we're collecting the same set of information from each participant, so the questions are the same. Can you imagine trying to find out about diabetes prevalence, diabetes complication, and patient adherence to diabetes medication, and there is no questionnaire, so each person is being exposed to different sets of questions as they move from interviewer to interviewer. So as the interviewer move from person to person, they may change the way they ask a question. That can ultimately lead to chaos. And in that kind of case, you're going to have poor data quality. And interviewer bias comes into play there. So you want to use a standardized questionnaire just to eliminate those poor quality and interviewer bias. One of the first steps in administering the questionnaire is to ensure that there is some amount of familiarity. So you want to get to know the layout and instructions of the questionnaire so that you can flow through the questionnaire during the interview. So you want to practice filling in the questionnaire if you are the person who is going to administer that. You also want to prepare for the interview by ensuring that you have the right instrument and that there are minimal grammatical, typographical, and those sort of errors so that when you are administering it, you can flow with ease. The second step is introduction. You want to introduce yourself professionally to the respondent, explain why you are visiting and what is the purpose of the survey that you are doing, and then determine if the person is eligible to participate. Many surveys have eligibility criteria, so for example, that might be by age, it might be by gender, it might be by place of work, it might be by rank, it might be by many things. So you want to confirm that. Then you want to note the willingness of the participants to be involved in the study. And that is where you're now going to obtain informed consent and then assure the person that this information is confidential and that it's voluntary. What does that mean? Their information will not be shared in a non-anonymous way, meaning that it will be de-identified before sharing and it will be shared as a group in form of a dissemination, and that they can withdraw at any time. So the Center for Survey Research talks about demeanor, and demeanor being very important when we conduct surveys or when we do interviews. So you want to be pleasant, but at the same time professional. So not too jovial so that participants don't feel that the process is not an important one. You want to listen actively and carefully so that you hear persons and what they're responding, so that if they're answering multiple questions at the same time, you do not have to repeat a question to them, but you are actually ticking off their response. You want to use your judgment in problem or emergency situation. Certainly, in my experience in working in survey work, we have had interviewers who have come under violent situation, and in those situations, what we tell them is your safety is important. We also recommend that you do interviewing if you are doing it in a community setting. Do it in pairs, so two persons go as interviewers as opposed to one. If you're a single female doing interviews with a household, you want to ensure that you are not going alone and that that household is not predominantly male, just to kind of avoid issues of accusations and any kind of emergency situation. You want to keep in control of the interview but be courteous at all times. Sometimes when you're doing interviews, people are tending to go off on a question to want to give you a story or more information. You want to keep that in check, but at the same time, you want to be courteous. You want to ensure that the details are given, so you want to read the informed consent in full. You want to check that the persons understand the informed consent or the consent form. You want to fill in all relevant identifiers, so like the questionnaire ID number, the person's name, before you start the interview. Because after you've started the interview, to go back, you might either forget or the person might be rushing on time and therefore you don't get that information and you have spoiled a questionnaire. The setting is important. You want to ensure that it is private, free from distractions. People are able to share their information with you confidentiality. So if you go to a home and you're interviewing, for example, a teen, they oftentimes don't want their parents to hear the responses. So you want to get into a place where it's comfortable, quiet, and also confidential. In terms of ensuring that you have accurate responses, you want to read all questions that are written, and if there are prompts or places for you to do definition, you want to do those, and then you want to probe. What is probing, you might ask? You ask a question and the person may give a one word answer, but the question requires more than a one word answer, or you have not heard a response that fits what's on your questionnaire. You want to dig a little deeper. So you might say, tell me more, go ahead, continue, explain. And those are some probing. So, for example, here we have on the screen some more probing sentences you can use. In what way? Can you tell me more? Is there anything else? Um, don't suggest the answer when you are probing. And that's an important aspect of probing because sometimes you are tempted to give the answer that you are looking for, but rather you want to just ask people to add if there's anything else to add. So let's look at some question here and some examples. So Joe, how was your day? Joe says that his day is bad, but do we really know what Joe meant by bad? Possibly not. In a standardized survey, we would want more specific information. In a regular conversation, we might very well accept this. So, in other words, we need to probe here to find out what Joe means by bad. So, answers that fail to meet the question's objectives are probed by the interviewer, and we usually do that in a non directive or neutral kind of a tone and way so that we're not suggesting the answer. You also don't want to skip any of the questions. You want to go through the questions. So when enlisting, R said, I hate smoking. So because you think the person said they hate smoking, there's a question that asks, do you think smoking should be allowed in restaurants? And because they said they hate smoking, you might think that, hey, you know, of course they're going to be against smoking in restaurants. But so you skip that question and you really shouldn't because that is kind of prejudicial. Time limit is important. While you are not rushing the participant, you want to set a limit, tell them of the time limit when you are done with the introduction. And if you are going to run out of time and you see that, you want to approach them and say that this is going to take a little bit longer than we thought. Can we have some more time? Slower participants may need more time. Always note that. Again, assure confidentiality. Ensure that the participant knows that the information, even though it is required, like name, and sometimes date of birth and address, will not be shared with the persons. And depending on the jurisdiction you're in, there are very strict compliance expectation, like HIPAA, which is a kind of privacy act in the United States that ensures that person's information, when collected as part of surveys or when collected as part of medical care, is kept in a confidential manner. So if persons refuse to give you information, that doesn't disallow them from participating in the survey. It is their right to do so. You want to ensure that you have omitted no questions, no blank spaces, and in closing, you want to thank the participant for their time and participation in the study so that you bring it to a closure. If you need to schedule a follow-up visit, you want to ensure that that date is made at the time so that the participant is aware that you might be coming back to them. There are different types of questions. So, some questions might require probing or prompting, and therefore we usually do that in different font type. So, for example, if you see uppercase letters, it is suggesting that you should not read that case, but rather it is instruction for the interviewer. If it is in bold, usually it is sending an instruction that the interviewer should emphasize that question or that point or that probe or that prompt. So look at this questionnaire, for example, formatted very nicely. The responses are there. If you notice in the first question that says, what is your union status? There is an instruction and it is written in all caps, right? So this is suggesting that this is not something that the interviewer should read, but it is an instruction to say, explain what union status mean if the participant is having difficulty, okay? So what are some of the advantages of the interview method? There is opportunity for feedback. If you are doing an interview administered questionnaire, if there is any kind of thing that require clarity, the participants can ask you. There can be probing for complex answers. You can give definitions. You can give examples or explanation. And the length of the interview, If it's a lengthy one, the personal interview is the best technique because people will get fatigued if they're on their own with a questionnaire. They might just stop, they might just rush over it and answer in a more flippant way and not giving it thought. So if it's a lengthy questionnaire, then you want to do a interviewer approach as opposed to a self-administered approach. You can have incomplete questionnaires if this is a self-administered approach, and so an interviewer approach is usually better for that. If you have props or visual aids, so for example you have a scale for pain with grimacing faces, you might benefit from an interviewer saying that this face represents someone who's in low degree of pain and this face represents someone who's in high degree of pain. If there are graphs that needs to be explained for people to come up with a response, then an interviewer being there is going to be best to explain that. And then one of the things we have found from research is that participation in surveys are higher when there's an interviewer administering the questionnaire. There are some disadvantages. If there's an interviewer, that person needs to be paid, so the cost factor increases. Then there is lack of anonymity, meaning that it's face to face, so the person sees the person who's asking them the question. And sometimes there are phobias, people don't want to share certain information. So certainly when you're asking about sexual orientation or sexual preferences or sexual identification or same sex relationships, people might not be willing to share certain information. Drug use, involvement in crime, violence, people might not be willing to share that if it's a face to face. And then the necessity of callbacks is an issue with face to face because, again, if the interviewer missed something, you might have to go again, and that requires extra funding to pay for that cost, and the time spent both by the interviewer and the participant is going to be affected. Sometimes you have what is known as a variance effect, meaning that the demographic characteristics of the interviewer can influence the answers of the respondent. So if they think you're a well-to-do person, they might want to answer to please you. If it's a male interviewer interviewing a female, she might vary her answer because she doesn't want to seem or to be judged by the male, and vice versa. Dishonesty, interviewers may cheat. Some interviewers' personal style, their questioning, their demeanor is just off putting. And there are some global considerations like cultural. Some people are just not into people questioning them, and so they might not want interviewers of a certain age. They may not want interviewers of a certain sex. So you have to take all of that into perspective when you are doing your interviews. I want to acknowledge Dr. Shelley McFarlane for some of these slides and the Center for Survey Research for also for some of these slides. And hopefully this has been meaningful to you. Always remember that you can stop the recording at any time, take some notes, write down some examples, and that's usually the best way to go. So until next time, see you.